And so this session is aimed to enable you to understand where we're at from a Zedmed perspective in releasing the functionality to support your move to Medicare Web Services. We also want to show you the application and how it will change as a result of Medicare Web Services upgrades. And we want to let you know what you need to do in order to prepare for the upgrade as well. As a first item on the agenda, though, I want to relieve any anxiety that you may have around the Services Australia cut-off date for the old Medicare adapter. This has currently been set to the 13th of March. However, as you may have seen in our recent announcement, we've negotiated an extension of that cut-off date for all Zedmed customers, and that's until the 30th of May. And this will ensure that you have sufficient time to stage and plan your upgrade to the new Medicare Web Services release. So to give you just an update on where we are with that particular release, we've currently completed our development of the changes that we needed to make to support Medicare Web Services, and we're now in the final testing and piloting stages before we make the release available to all of our customers. This is a major change in the software solution, and that is all necessary to enable the web services approach to Medicare claiming. And so what we're doing is we're piloting this first to ensure that we minimize the potential impact on the broader base of our customers. And following that successful trial with our pilot sites, we're planning to have the upgrade available for a staged rollout from early March. We'll provide further updates over the coming weeks to let you know when and how you can arrange the timing of your particular upgrade. So this should fit into the way that you are running your practice, the IT resources that you may use to arrange upgrades, or for those that actually use Zedmed to do the upgrade, to be able to book that in and have that scheduled to occur. One thing just to enable you to understand further about what is changing and how that's changing and the approach that you need to take. So if we could move to the next slide, we can just show you that we have a number of resources available for you, and they're there for you to access at any time. So there's information and an FAQ document which enables you to understand about what you need to do to prepare for your upgrade. There's some critical information that we'll talk to you about today in terms of upgrading your PKI Medicare certificates if they haven't already been done. There's additional resources such as being able to view this lunch and learn and other previous sessions that we make available, as well as the normal contact details for our support centre. And we will be running some more targeted sessions, particularly based around one for GPs and one for specialists. But I think the best thing for you to help to understand this is for us to be able to demonstrate what the application will look like once we have implemented the Medicare Web Services changes. So for that, I'll hand over to Fane.
Thank you, Neil. Just going to share my screen and I'll take you through some of the key changes. And in Zedmed, there has been some changes moving to the Medicare Web Services within the interface, and there's also some enhancements to what it's currently looked like. So I'm just going to share my screen. You should be able to see my screen now. That's good. Okay, so what I'll take you through, it's more of an overview and what your and the expected change in Zedmed. I will be running 2 webinars next week, and that's targeting more of the GP clinics and then also looking at the specialists because of the different in workflows and processes and the way you use the system. So I'll take you through more of a high-level overview of looking at what's changing, and then I'll go into the specifics next week. That way it's kind of cater to and more tailored to your current workflow. So having a look at Zedmed, the first thing I want to cover is that in terms of upgrading, I'm just going to expand my screen, that way you can see it. There. So we're looking at moving, the next version is Zedmed version 35. When you upgrade to Zedmed, there will be some things that we'll put up online and in our documents as well that you need to follow through. There are two main setups that you'll be doing, and I'm just going to show you those two. The first one sits at a practice level of Zedmed. Once an upgrade's done, there will be an instructions that comes with it. You will need to contact our team, and more information will come out how we're going to give this out. There is a additional tab that's been added, and that's claiming configurations under the practice details tab. And that's once you upgrade, we will provide you with a key. And like I said, communications will come out how this is going to be given out to our clients, and you just need to enter that key into this field here. And this is at a practice level. The next one is when you are to set up a doctor. So once the upgrade's done, and for new doctors, oh no, not new doctors, for your existing doctors that's been set up, there will be a tick box here. There's a new tick box in another field to register, and also to register the doctor for claiming. So that's part of the setup you'll be doing. So in this field, it'll have register a new registration, and once it's been registered, it'll have active, and then that'll be tick. Now, currently, this HIC online is the settings in Zedmed that allows you to transmit for that particular treating doctor. So that's moving to claiming. So that no longer will be needed, and the new settings will be down the bottom here. So those are the two setup, a practice setup and a treating doctor setup. Now, I will show you now what it looks like inside a patient record, and some of the changes we've made. Just going to bring up a patient here. So this is a patient details screen. Down the bottom here, currently you'll see two buttons. You'll see online PV and DVA PV for patient verification. That's now all been put together into one. So that'll become patient verification. So if I click patient verification, this will do three things in Zedmed. If you're more of a GP clinic, you'll see it'll go through and do a Medicare verification, and it'll do a DVA and three. It does Medicare, DVA, and concession cards as well. So if I click OK here, if I did have a concession card, it'll come up with a tick. So if I click OK, so that's field there, Medicare and healthcare card and DVA. Now I'll bring up a patient also if they've got health fund, so that can still be tested as well. Verified as well. I'm going to bring up this patient. I'll go patient verification. I've got my patient set up, Medicare card here, and the health fund details on the right hand side. So if I click OK, it'll go through and check Medicare and the health fund as well. So patient verification is just removing the additional button and then just putting them all to one. So to summarize what it does, it checks Medicare, it checks healthcare card, it checks DVA, and it checks the health fund. So that's new. In terms of billing and how you do things, everything that you currently do in Zedmed remains the same. In terms of creating an invoice, where you bill from and how you create an invoice, that remains the same. If I go into bill a patient, this screen here, the workflow, you start from your payer, your doctor, request where it's relevant, and then you've got your item number field. Just going to put in an item number here just so I can show you. So in terms of what's changing in this screen is if it's a private patient, that remains the same in terms of how you would go about creating your invoice and taking the payment and recording it. that remains the same. If it's a patient that needs to be sent to the health fund via Eclipse, that process remains the same, where you put in your payer. Down the bottom, you have the Eclipse coming up, and you still specify your hospital the same way. Properties, this field remains the same. What's changing if it's a bulk bill? So if Medicare is the payer, so I'm just going to bring up a Medicare patient. If I build this patient and I change this to Medicare, select a doctor, I'll put in item number 23. So what's changing is down the bottom here. You now have the ability to click on bulk bill, and that'll transmit the claim straight away to Medicare. So there's no longer a need for you to suppress it and batch it. There's no more batching involved in terms of transmitting your or submitting the claims to Medicare. So kind of moving away from the batching term, because you'll have the ability to send it straight. Now, if you are a practice that still wants to kind of hold the invoice and submit it at the end of the day for review, for example, you can still do that. You can still suppress, hold them, and you can transmit them at the end of the day. Otherwise, in terms of the new claiming functions in Zedmed, you can click on bulk bill, and that'll basically send the claim to Medicare. Now, currently, if you are to batch something and you send it and you've made a mistake, that process remains the same. So you still need to contact Medicare if you accidentally submitted the claim and you forgot to add an item number or make some changes, or you submitted the wrong item. So in terms of billing, that's the same. That's the new change. If it's I'm just going to show you if it's a private patient. If it's a private patient invoice, I'm going to put in, say, a 23, and I'll go into quick pay. This is what you would currently do at the moment. What you will notice is that you'll have more options here. So you've got cash, check. These options, you can choose what to remain on the screen, and you can remove some of them. So if you're no longer taking checks in, you can untick it so they don't come up. There's also FPOS and then Tyrell Easy Claim. If you're using Tyrell FPOS terminal, then you can click Tyrell Easy Claim. That'll connect directly to the Tyrell. And then down the bottom, you still have the option to, if I go FPOS, you still have the options to MA Online, Eclipse an invoice from this payment screen. So this process doesn't really change. The big one is if it's a bulk bill, and instead of suppressing, you can now send the claim directly. Just to cover off something that I didn't mention earlier, if you're doing a patient verification, currently if the last digit is incorrect, or the Medicare number is incorrect, or address doesn't match, it'll give you a message. So that message will kind of change it to tell you if the address is wrong. It'll say the address is wrong. If it's something that you need to contact Medicare, the messaging is slightly different. The message will tell you to contact Medicare. So say the DVA, if it's a DVA patient, I'm just going to show if I do a DVA patient. So I just need to find a DVA. Here we go. So I do want to show you a DVA, doing a bulk bill for DVA. Scroll down and select my doctor. Click OK. So this will go through, and it gives us a exclamation mark on the first two, but it says the patient's eligible for concession. Now this is if the details needs to be updated. This is the new message I mentioned earlier. it'll come up with a suggested update to the patient's record. It'll change it from this detail to this updated details. And if I click update details, it'll go through and update the record in Zedmed. And if I am to bill DVA, DVA is the payer. I'll select a doctor. If I put in say 110, down the bottom, instead of bulk bill, it'll have DVA as the button down the bottom. So I can go DVA, and then it'll send it through. Okay. So I'll click close there. So that's basically how you in terms of billing and what's changing and creating the invoices and stuff. Now under management, so on the left hand side, you'll now see claims instead of batching. So there is this new claim tabs that we've put in here, and I'll click into that and I'll talk about it. I'm just going to expand it. So we now have a claim status, a new screen that comes up. This window, you will see any submitted claims that you've submitted to Medicare, to DVA, DVA Allied, and also via Eclipse. Same goes if you're using Tyrell, that's still going to Medicare, that will show up here as well. So in terms of the specifics and how different practices do their invoices, I will cover that next week, but this is just more an overview looking at what this claim status screen gives us. Now inside the claim status screen, we've got two tabs. So we've got claims, which is all the claims that you submitted. And then you've got payments, and I'll talk about claims first and then payments. So what we see under claims, the to and from date, this is invoice date, not service date. This is invoice date. We can also see the claim, different claim types. So we've got bulk bill for Medicare, DVA. So if I just want to see any claims that were submitted, when I click bulk bill, so I'm just going to select it and I'll hit refresh on the top left hand side, and that'll give me all the invoices that was bulk bill. So, and that sits under between that period. And same thing if I select DVA, I'll hit refresh, it'll tell me I've only done one, which is the one I did earlier. So I'll go back to all submitted claim types. So this is all the submitted claims. So I've got bulk bill, DVA, inpatient medical. This is the Eclipse invoices. So any invoices sent via Eclipse, they're going to come under inpatient medical. So you can see if I expand an invoice, you'll have an invoice number. You've got the claim submitted to Medicare, and then it went to the fund as well. It will tell us who the fund. I will talk about this in more detail shortly. So that's inpatient, and I've got VAA, that's for DVA Allied. I'm just going to go back to submitted. And here as well, you've got not submitted. That's just to give you any health invoices. So when you create an invoice and you click suppress, it'll just stay in the system until you come here and transmit it. Now this is important for after you upgrade. Now we did mention some recommended steps on what you do pre-upgrade, where you will need to, if you are to bulk bill, you can hold your bulk bill invoices and do them and submit them after you upgrade. If you create this bulk bill invoices prior to upgrade, you can leave it in Zedmed and it'll be picked up under not submitted. So the first working day after the upgrade, you'll come and tick all or not submitted invoices, and it'll come up with transmit claims on top right hand side of the screen. You'll be able to transmit those claims in like a bulk transmit. So if you're wondering how you're going to transmit those bulk invoices, those invoices after the upgrade, you can do a bulk transmit after the upgrade. And it's the same function that you'll use if you are to suppress a bulk bill invoice. You can come and transmit it at the end of the day. Now, the right-hand side, it's just basically filters. You can filter by branch, status, treating doctors. You can, if you want to look up a patient, if you've got a big clinic, a long list, and you want to just search different patients, this is where you look for it. There's other search fields as well, such as claim ID, payment ID, and invoice. In terms of what you see here, so what's under this screen, I'm just going to collapse all so we can see it. We've got a column for the invoice, so it comes up with the list of invoice numbers. You've got the date of the invoice, a status. Under the claims tab, it will tell you a status of where the invoice is at with Medicare. So processed, and there's a complete. So once it's completed, technically it means the payment should have come through, and we can see that under payment. I'll talk about that shortly. You've got your column for patients, outstanding, what's outstanding, what Medicare paid, we'll talk about that. The treating doctor, any reference numbers as well, it's on the right-hand side. So that's what you can see under claims. If I expand an invoice, I can see what item numbers were under that invoice and any payments that has come back from whether the fund or Medicare. So that's claims, and then payments. I'll go into payments. So under payments, what you see again from to, that's a date based on service date. Sorry, invoice date, not service date, invoice date. You've got your payer. So under the payments, this payer list will stay the same if you're a GP clinic. It will grow if you're using Eclipse. So your payer, any payments coming from DVA, I can select it DVA. This is if I want to filter this window. If it's Medicare, you can filter it as well. If it's Bupa, if it's submitted by Eclipse, the individual health fund names will come as a payer under here, because that way you'll know exactly where the payments has come from. So whether it's a Bupa or Teachers Health Fund, NIB, they're going to start coming down here as a individual payer, and you can filter that as you go. You also have on the right hand side, you can tick just to see any new claims, those invoices that hasn't been receipted. You can tick that. If you want to see invoices that has been receipted within this period, then you can do that as well. So under the payment screen, I'll talk through what's coming up here. So if I expand this column is under claims, this column was invoice number. Under payments, it comes as a payment ID. I'm just going to expand it so I can talk through it. So if I, under the payment ID, this basically means that Medicare can make one payment for 10 invoices you submitted today, or DVA will pay one payment for 5 invoices that was submitted today. So if we think about it compared to what you currently do, this is your receipt number for that batch kind of thing. That's what the payment ID is. It can be paid back in a kind of payment batch type of thing, but and then in the new system, it's called a payment ID. So it's likely you'll see more invoices list under here. And so I've got a payment ID, the payment date. This is good for when you go do a receipting, it'll automatically add the payment ID, the payment date. You don't have to manually look for the printout and then manually enter it. You've got a status new. It just means that it's just a new payment that just came into Zedmed. You've got your payer. The payer here is Medicare. So if I am to filter this to Medicare and I'll hit refresh, It's only going to give me any new payments from Medicare. And if I expand this, oh, I'll go expand all. So I can expand all, and then I can see who my patients are. Just going to take this date back, and I'll expand all. So you'll see any reply for Medicare, it'll have a descriptions down the bottom here. Trying to look for an example. So you'll see the invoice number that the payment is coming into, and then this is the amount paid, and this is how much Medicare paid. It's probably not a good example, this one. So submitted $39.10, and then Medicare pays $31.70. Any reasons for that overpayment, it should come up under the invoice line here. Just going to take this back again. Oh. And I'll expand all. So I should have a line. I'm just going to expand this. So any rejections, it'll come up with a description next to it. So you'll see under the payments tab, you will see this description of why an item number wasn't paid, or why a whole invoice wasn't paid. The reasons will give you, it'll be available to you on the screen. So that's the payment reasons. And then if I want to receipt any of these payments, I'm just going to go and reduce my time, my date, and then refresh. So I'm going to go back to all. And if I want to receipt this, so I can see Medicare paid. If I want to receipt some of these invoices, basically need to tick them. You'll have options up the top available to you. So I can reconcile payments. Now I've got a payment reconcile options coming up. The system will go, if you let Zedmed, if allow over payments and adjust under payments are ticked, it means Zedmed will go through and adjust the invoices for you. So allow over payments, it means if you submitted $39.10 and Medicare pays $50, the system will increase the invoice for you. So those adjustments that you currently manually do, at moving to the next version, it'll do it for you. Same thing with adjust underpayment. If Medicare underpaid your claims, or they didn't pay any of the invoices, it'll just automatically discount that invoice once you proceed from this screen. So this is some of the clinics you come across a lot of these adjustments, especially when you haven't updated your fees, for example. So this is very useful and handy for that. That way you don't have to do the manual adjustments. Ignore underpayment, that's an option you can tick, and that's basically to just leave it because you're going to do a manual adjustment. So the invoice can still be receipted, but you need to go after and do a manual adjustment. Void rejected. So any items or invoices that are rejected, you can tick it here and the system will go through and reject it. In terms of resubmitting to Medicare, same thing. If an invoice was currently comes through and it's rejected in your current batch, the way you would go about it to resubmit is that you'll void the invoice, recreate and submit again. So that process remains the same. You can let the system void those rejected invoices, and you can then, that way it makes it easy for you. You just go and create the new ones and fix it up and submit it. So if it was rejected because no referrals were added, same thing, let it void it, go recreate your invoice and then submit, go through creating the invoice and submit it again. So that's the claims and payment screen. And no, it looks slightly different, but I think this way kind of saves a lot of time and effort in terms of manual batching. There's no more going into different store like before. So this way it's just in one central place. Yeah, so look out for communications coming in shortly or very soon regarding the specific workshops I'll run with different clinics. And now I'll hand over to Neil.
Great, thank you, Fani. So as you can see, there's quite a lot of changes that have been made to the application as a result of this change to Medicare Web Services. Now, so that actually is concluding our session. What you'll see just up on the screen in just a moment is we have created a QR code for you there. If you wanted to scan that, you'll be able to get direct access to all of the support material we have, the FAQs that we have, the links to all of our current support services related to Medicare Web Services. I do want to thank you for your attendance here today. This Lunch and Learn, it has been recorded, so it will be available for you towards the middle of next week if you want to go back and review that. Also, I'd like to just summarize what we've been through today. So you've heard that we have an extension to the 30th of May for the migration of Medicare Web Services. You've also seen how claiming works in the new release of Zedmed. You have now got access through this QR link or through the other material you've seen in the presentation to the FAQs that have been prepared. We have updated those already from questions that we had from our previous session, and we will also update those from questions that we've received from this session today. So we'll continue to keep those updated also from any queries that come through our support desk. One thing that we just want to re-emphasize is the importance of updating and upgrading your Medicare PKI certificates. So for those of you who have not already done that, we understand that all of those will be expiring on the 13th of March, so there's no extension on that, but Medicare has already sent out CDs for that purpose. And if you can go through that process and do that upgrade, then that is going to be very beneficial to you. And if you have problems with finding the CD that was sent out, then in our contact material, we've got the Medicare contact details for you to go back and get them to reissue that. So we've been in touch with them about this, and they are prepared to do that over these next couple of weeks before the 13th of March. So we want you to really start planning your upgrade. Think of the things you need to do. There's some preparatory work, as we've talked about, with PKI certificates and in terms of the holding of transactions, etc. And so we will then keep you informed of when our staged rollout is commencing and how you go about registering yourself in that process. So thank you again for your attendance, and we look forward to the next sessions where we can explain this in a bit more detail.